A 40-year-old man was visiting the local government hospital with complaints of a skin swelling on his right index and middle finger with discharge of pus. He was advised certain investigations, including blood sugar, and treated with antibiotics. It took around 7 weeks for the skin lesion to resolve. The patient came back after about 7 months with similar complaint. The skin lesion took a long time to heal. During the initial visit, if the doctor asked this patient, who was a sheep herder, one simple question: "What exactly is the nature of your work?" the doctor would have arrived at an accurate diagnosis of a clinical condition called ORF. ORF is an exanthemus disease caused by a virus occurring primarily in sheep and goats. It is also known as contagious pustular dermatitis, infectious labial dermatitis, ecthyma contagiosum, thistle disease, and scabby mouth. ORF virus is zoonotic. It can also infect humans. Simple instructions to good hand washing practice and use of gloves while handling the animal would have prevented the recurrence. Effective history taking has long been identified as a core discipline in treating patients. Spending more time compiling a good patient history has been known to provide the most benefit as compared to long physical examinations and expensive laboratory tests. Collecting an incomplete history can affect initial therapy and all subsequent decisions for treatment. Therefore, it is essential that primary care physicians ensure that neither the patient nor the health system is unduly burdened by deficient history taking. Primary care providers and family physicians can play an important role in improving the recognition of occupational disease, preventing progressive illness and disability in their own patients, and contributing to the protection of other workers similarly exposed. This role can be maximized if physicians raise their level of suspicion for workplace disease, develop skills in taking occupational histories, and also learn basics of advising prevention. In our country, where agriculture is the main occupation, animal husbandry is one of the main supporting occupations. During older times, a man's worth was evaluated by the number of livestock animals he or she owned. In the present times, livestock-generated output contributes to 4% of GDP. Livestock products mainly used by people include milk, eggs, meat, leather, and wool. Distribution of work. Animal husbandry encompasses several trades that mainly include the following tasks. 1. Animal herding. 2. Grazing. 3. Ranching. 4. Domestication and breeding techniques management. 5. Aviculture and Poultry Farming. 6. Pig farming. 7. Sheep husbandry. The major health challenges of animal husbandry sectors are effective control of animal diseases, vector control, and the prevention of zoonosis. Methods of work or operations involved. Animal husbandry practices involve dehorning cattle to prevent injury to other herd animals and farmhands. Methods for housing livestock, providing adequate nutrition, devising breeding strategies, and managing pets that live in the household. Domestication and breeding processes. Incubation, lighting technique in broiler production. Artificial insemination and embryo transplantation in cattle, horse, and sheep husbandry. Milking, shearing, crutching, and culling and slaughter. Other tasks include animal feeding, watering, waste management, sanitation, carcass disposal, pest control, veterinary care. Characteristics of work. In the course of their work, the workers working in contact with animals face many health hazards which can be broadly described in 3 categories. 1. Development of allergies. 2. Zoonosis. 3. Animal bites and scratches. Development of allergies. Common clinical symptoms of allergies include inflammation of the skin, nose, eyes, and urticaria. Individuals who develop allergies to animal dander and excretions are at increased risk of developing asthma. The major sources of allergens are 1. Animal bites, animal dander, and excretions. For example, urine, saliva. 2. Airborne bedding dust and other respiratory exposures. 3. Exposure to allergens can be minimized by 4. Wearing protective clothing and gloves when handling animals. 5. Reducing exposure to airborne dusts, dander, and exhaust systems. 6. Practicing good personal hygiene. 7. HEPA filter respirators or masks may help prevent the development of allergies. Zoonotic diseases. As you may be aware, the serious health hazard faced by the workers, diseases transmitted from animals to man, are called zoonotic diseases. Zoonotic diseases, although uncommon in the laboratory setting, can have significant health consequences for animal husbandry personnel. Some of the diseases are rabies, anthrax, leptospirosis, and toxoplasmosis. Persons most at risk are 1. Immunocompromised personnel, for example, those who are HIV positive or are taking medicines like steroids, chemotherapy, post-transplant therapy, and certain arthritis medications. 2. Pregnant women employees. Risks can be minimized by using 1. Appropriate handling techniques of animals, their tissues, and caging. 2. Wearing protective clothing or devices. 3. Utilizing appropriate personal hygiene practices will greatly reduce the danger of diseases. The development of zoonotic diseases can be prevented by various measures such as practicing good personal hygiene, wearing protective clothing, gloves, and masks while handling animals, vaccination and regular checkup of animals by veterinary surgeon. Animal care personnel are expected to change their clothes as often as necessary to maintain a clean appearance and prevent contamination to other areas. It is also important to cover veterinary practices involving livestock at this point. Breeding techniques, delivery of offsprings, inoculation, and disease management are some of the veterinary processes that overlap with animal husbandry tasks. Good practices. Health risks can be substantially minimized by 1. Using appropriate handling techniques when manipulating animals, their tissues, and caging. 2. Following proper sharps, needles, scalpels, glassware, management practices. 3. Discarding used sharps immediately after use in a designated sharps container. 4. Avoiding recapping of needles or improperly disposing of scalpels. 5. Avoiding overfilling of containers. Protective clothing should be changed as appropriate to minimize cross-contamination between species or activities in different animal rooms within the facility. Protective clothing should not be worn outside of the work area unless it is necessary to perform assigned duties. Hand washing is the most effective practice in reducing the potential of exposure to infectious material. Hand washing should be performed 1. at the start of the workday. 2. Upon leaving for breaks, before meals or after restroom breaks. 3. When returning to work. 4. After handling of any live animal or animal tissue. 5. After handling any other potential source of contamination. Children at work. An unusually high number of children may be involved in animal husbandry tasks. Within some communities, all family members, particularly children, spend many months shepherding in remote isolated areas, tending animals or participating in heavy work, such as leading livestock long distances to water sources. Herding, shepherding, and handling livestock may be considered as hazardous work. Injuries from animals include being bitten, butted, jostled, stamped on, gored, or trampled. Large and small animals do not need to be aggressive to cause serious harm or even kill a child. Children rarely wear protective shoes or boots, and this increases their risk for additional injuries and illnesses such as cuts, wounds, bruises, thorn injuries, skin disorders, and infections. Diseases can be contracted through routine contact with animals, insects, pathogens in animal carcasses, and work near livestock stabling areas and butchering houses. Exposure to crop dusts and contaminated plant material, water, or soil can also pose a health hazard to children. Additionally, livestock dust can penetrate deep into the lungs, causing health problems. Chemical products, including disinfectants for use in livestock production, contain caustic or corrosive materials and may be stored in places accessible to children. Fumes released when mixing and applying products can be a particular health hazard for children. Among the zoonotic diseases, avian influenza is a major risk today. Health condition and causative source. Injury conditions. Bites, scratches. Rabies is the most important health risk from bites and scratches. Wash the bite area. Apply pressure with sterile gauze or a clean cloth if the bite is bleeding. When the bleeding stops, apply antibiotic ointment and cover the area. Anti-tetanus and anti-rabies immunization is absolutely essential and must be given immediately without waiting for report on the animal's behavior. Immediate immunization of all other workers in contact with the animal is advised if its behavior indicates rabies infection. Causative factors. Unpredictable animal behavior often puts workers closely associated with the animal at risk. Workers, especially women and children, may use handling techniques to which the livestock are unaccustomed. Musculoskeletal injuries like kicking, butting, crushing. Causative factors. Indulging in risky behavior, such as positioning oneself within the flight zone of an animal or positioning oneself in the blind spot, triggering a kicking or butting reaction by animal, causes injuries. Crushing, especially in women and children, may occur due to the sheer size difference between the animal and the worker. Blacksmithing injuries. Cause. Blacksmithing or furrier work includes tasks such as applying horseshoes and involves substantial muscle activity to prepare metal and position animal legs and feet. This may lead to musculoskeletal injuries or wear and tear. Blacksmith activities per se can also put workers at risk of metal fume fever. Zoonotic conditions. Anthrax, Tinea capitis, ORF. As explained earlier, ORF is a contagious pustular dermatitis disease in sheep and goat that can be transmitted to humans. The appearance of a purulent papule on the fingers, hand, arm, face, or penis. Causative factors: skin contamination through direct contact or contact with animal secretions, urine or dung. Avian influenza has a higher incubation period than other influenza types, but unusually aggressive course with rapid deterioration and high fatality. Lower respiratory affection early in the course of the disease is a warning sign. Indicative symptoms are voice hoarseness, crackling inhalation sounds, hemoptysis, and respiratory distress. Epistaxis, diarrhea, vomiting, and abdominal and chest pain may also occur. Complications are hypoxemia, multiple organ dysfunction, and secondary infections. Causative factors: direct or indirect exposure to infected live or dead poultry or contaminated environments such as live bird markets. No evidence to suggest transmission through properly prepared poultry or eggs. However, slaughter, defeathering, handling infected carcasses, and preparing poultry for consumption are risk factors. The disease is always preceded by an outbreak in poultry animals. Rapid and total culling of all the animals, whether infected or not, must be executed. In suspected cases, oseltamivir should be given as soon as possible, preferably within 48 hours following symptom onset, as it can reduce the viral replication and improve survival rate. Corticosteroids are not recommended. Bovine tuberculosis, Campylobacter infection, Cryptosporidiosis, Salmonellosis, and trichinosis. Causative factor: ingestion of undertreated animal products. Q fever, onset usually marked by influenza-like symptoms but soon progresses to pneumonia and acute respiratory distress. Chronic form of the disease resembles endocarditis. Causative factors: humans infected through inhalation of infected air particles. Since this is a lambing disease, it may occur during breeding time. Direct contact with milk, birth products, urine, and feces of infected animals is a predisposing factor. Middle-aged males are predisposed to infection. Human-to-human transmission has rarely occurred through sexual intercourse, during delivery, or by blood transfusion. Respiratory conditions: asthma predisposing factors. Persons at greatest risk already have asthmatic or have allergic reaction while working with animals. Allergic rhinitis, hay fever. Causative factors: pollen inhalation, inhalation of animal hair, dust mites, molds, urine, dander or saliva. Anaphylaxis. Cause: usually caused on first-time exposure or contact with animal or animal products by a worker with hypersensitivity. Anaphylactic reaction occurs within minutes to hours after contact with allergen. Dermatological conditions: eczema and urticaria. Causative factors: contact with animals or animal products like caterpillars, dander. Allergic reaction to pelt extracts from rats, mice, and rabbits are known. Major urinary protein complex in rats and mice has been identified as an important allergen. Drying of the urine and the persistence of the urine protein in dust or clothing may be a possible factor in allergen contact. Preventive interventions require strategic contribution and efforts from government through occupational health and safety policy and legislation, cooperation from employers as well as workers, and advice from medical professionals. Occupational diseases manifest after long latency period from the time of exposure. There are challenges to establish and declare that a disease is due to hazard at workplace. Elaborate guidelines for management and prevention of occupationally caused diseases is beyond the scope of this documentary, as currently there is no mechanism for doctors to enforce their recommendation without a statutory backing. We therefore give general principles of prevention. Preventive measures should be designed and implemented at 3 levels of prevention. 1. Primary prevention aims to reduce the occurrence of disease by eliminating the cause of disease, for example, use of benzene-free solvents or solvent-free paints to eliminate the risk of carcinogenicity, or reducing exposure to safe levels that prevent it from causing damage, for example, reducing noise at its source to levels that do not cause noise-induced deafness. 2. Secondary prevention to identify and treat health problems as early as possible, often before symptoms have developed, in order to take corrective action. For example, regular audiograms among workers exposed to high levels of noise in the work environment. 3. Tertiary prevention aims to avoid complications of and disability from illnesses and injuries and/or to provide rehabilitative and palliative care. It aims to minimize the consequences in persons who already have disease and depends on appropriate treatment. We expect that the primary care physicians are already well versed with clinical knowledge for management of the occupationally caused health conditions. To learn more about detailed clinical perspective, treatment and prevention and control, please refer to e-book or printed version of BOHS for Informal Industry, Manual for Primary Care Providers. So, if your next patient with any of the presenting symptoms we described earlier comes for treatment, please don't forget to ask him the $1 million question. What exactly is the nature of your work?